very early on in the pandemic, even before the vaccines were approved, people were contacting me and saying, I'm not keen on taking this. At the time, they saw it as an experimental and new and untested vaccine. They didn't want to take it. And what we needed at the time were clear messaging from the government saying, first of all, it's been properly tested in different groups of people, and it isn't, you're not going to be the ones who are taking it first and the only ones in it. So that reassurance didn't come. And by the time the reassurance came, people had already started listening to, if you like, other voices who were suggesting they shouldn't take it. So it's all about timing and also about clear messaging. The other thing is, early on again in the pandemic, the virus was allowed to become what I call racialized. That means it was linked. So if you were from it was thought that if you were from a certain ethnic group or racial group, you were more likely to suffer from the vaccine. And rather than accept that this was due to social factors, it was suggested that it might, or it wasn't said, but the implication was that could it be something genetic linked to these groups? And because things like that weren't stamped on, the moment you racialize a virus, you racialize the treatment for the virus, because people are going to think, right, if the virus is affecting us more, could the vaccine also affect us more? So all of these things needed to be taken into hand when people were talking about giving people vaccines. You really had to sort of address these questions, and they were never addressed by, as I said, trusted messengers in a very specific and localized way. If you look at the progress that's been made early on, the Bangladeshi community, for example, they weren't taking up the vaccine, but then what people got to do is to actually talk to leaders in those communities and have really focused, localized campaigns. And you can see the difference if you look at the data. Bangladeshi community now one of the communities that are really taking up the vaccine in a much more in a similar way to the white community. So you really have to be very targeted in what you do. And that campaign has been successful. Theoretically, it's possible to get a similar campaign for other communities, but it's going to be much harder as time goes on.